such a thing as bipolar and it affects children?
When I went to graduate school in the 70s, they taught us that the typical first episode of bipolar disorder occurred when and they gave you an age, a mean age or medium age of 33 years of age. So that when you work with children, it just was never diagnosed, never thought about. Well, as the years went on, more and more children were presenting with aggressive, violent rages that would last sometimes for hours, beyond anything that you would normally expect in a child. They also started to see children who were hypersexual. They seemed to be have a knowledge and a predilection for sexual ideas and energies that you just didn't see in children that age. I'm talking about children as young as 3, 4, and 5. And they started to realize that there was something going on with these kids. And whether it will remain as bipolar, I mean, they've now come up with 6 subtypes of bipolar, in addition to just the bipolar, there's 6 subtypes. But there's a syndrome now, they call it bipolar in children. And Dr. Papalos is the one who's really most well known for documenting this. Where these are kids who have mood swings and they have classic bipolar disorder, which was really kind of unheard of around 30, 40 years ago.
So every manic attack has to follow with attack in the other direction?
No. The cycles fluctuate. You could have just neutral mood, agitated, up, what we call it, an up mood, agitated mood, and then could go on for a year, and then maybe 2 years later, suddenly despondent, depression sets in for like weeks or months at a time. No, it's not. I know what you're saying. That is that common idea. Oh, they're cycling. They're going up and down and up and down, and it can help many kids. Usually, the yardstick we use is obviously when the disorder becomes to the point. Obviously, if it's life-threatening, and what I mean by that is when some of these kids go into a rage, they will all judgments out the window, and they will start doing extremely dangerous things, like had kids crawl out on rooftops from their window, go to the kitchen cabinet, get a knife, and threaten to hurt himself or his parents if he doesn't get his way. So that's obviously children that are that at risk.
Are there more cases today than we've had the last 10 or 15 years?
Well, this
is more recognized.
Well, this is a big controversy. The numbers of diagnoses of bipolar children has gone up astronomically. Now, is it a question of just more information, more knowledge, and we're recognizing it, whereas years ago, they were probably, many of them were labeled something that is still around today called intermittent explosive disorder. That's what they used to be called. But there's a lot of, I've seen a lot of overdiagnosis of it. In fact, as a very important point with these diagnoses is most children who have a childhood psychological disorder wind up with a second and third and fourth disorder, meaning they have to, they call them complex cases. The typical ones, you'd have a kid who has ADHD, and then they also have ODD, oppositional defiant disorder, and then they also wind up with Tourette's syndrome, possibly again with the learning disabilities or differences, and also anxiety is a very common occurrence, comorbid. So there's a tendency for the field to feel that there's been a controversy. Is the category becoming almost unhelpful, because now you're just taking any kid who seems to be difficult and call them a bipolar child.
So diagnosis is critical to be done by a real expert.
Yes.
Also, you remember as a kid, how do you see real bad allergies, food allergies like peanut allergy, occasional kid.
Right.
Today it's commonplace.
Yes.
Some of these things, I don't know if I was aware of it, or are they becoming more prevalent? Could there be something that's changing?
Well, obviously our environment has changed over the last 50 years, and there's more pollution, and efforts are made to clean it up. But I have the sense the same way. There's the number of kids who come into me diagnosed with food allergies. It's almost a calling card. I have myself some family members now who have, they must have, these are little children, 5, 6, 7, 10 allergies, which really I didn't really come across in younger years.
So something's happening, and I think 10 years now, someone's going to come, aha, I figured it out. Is that correct?
Yes.
Not us, somebody else.
Mm-hmm.